Good morning, John. It is the year 2026, and it's pretty frustrating that people are still dying of preventable infectious diseases. But it's even more frustrating that people are dying of preventable infectious diseases in a world where we have proven that it is actually possible to eradicate an entire disease from the world. And we proved that in 1980, which was, let me do the math real quick, 46 years ago, because that is when I was born, and that is how old I am. Not only have we eradicated one disease from this world, we've eliminated a lot of them from whole continents and countries, so we know that this is possible. Smallpox is the only human infectious disease that we have ever entirely eradicated from the earth, though with polio and guinea worm, we're within striking distance. Meanwhile, rubella has been entirely eliminated from the Americas. Measles was for a bit on and off, back and forth, less so suddenly. Malaria has been eliminated from the US and Europe and parts of Central Asia. So it seems like if one disease can be eradicated, we should be focused on eradicating all of them. Because boy, a world without diseases sounds nice. Why aren't we doing this? What is wrong with us? Well, not nothing. Like, there is more that we could do. There are diseases that could be eradicated that haven't been. But there are also diseases that can't be eradicated. Diseases are all different from each other, and some pathogens are easier to eradicate than others for a variety of interesting and surprising reasons that I'm about to tell you about. Now, to start this off, I want this to be clear. Smallpox was very difficult to eradicate, and it took a lot of coordinated, high-quality human effort to get that job done. It's a big world, and there are a lot of people, and a lot of those people are sick. But smallpox also was a somewhat ideal candidate for eradication for a bunch of different reasons, and looking at why helped me get my head around why some diseases present much more complex challenges. And we're going to start with probably the most important factor in whether a disease is even technically eradicable, which is reservoirs. Not the lakes made by dams, but places a disease can hide and then come back from. Smallpox didn't have any. Smallpox exists in people during the course of their disease, after which the patient is either dead or the immune system eliminates the pathogen entirely from the body. And very importantly, only humans can get smallpox. Now, some diseases like tuberculosis have a tremendous human reservoir that is latent. So even in the US, where TB is relatively rare, something like 13 million people have tuberculosis bacteria in their bodies, but have no symptoms. Now, while the disease is latent, they almost certainly can't transmit it to other people, but it may stay dormant in their body for decades before the immune system falters and the pathogen is able to emerge and create disease. And at that point, the disease becomes transmissible. And then it might get transmitted to someone who doesn't develop active TB. They become a reservoir, and they might be 20 years old, and then they will have their disease come out when they're 70. So to eradicate tuberculosis, you don't need to just get all of the active TB infections that are like visible and causing symptoms. You have to keep putting out fires for decades as latent infections emerge. Now, tuberculosis also can infect animals, but it seems like the TB that infects animals and can transmit to humans are a little bit different from the bacteria that's specialized to humans, so this is less of an effect in tuberculosis animal reservoirs than the latent reservoir, but there are diseases that have very active animal reservoirs, like influenza A, which can infect everything from seals to seagulls, and specifically there is influenza A circulating among waterbird populations all of the time, and they just have it and they can infect people. So you could get every bit of influenza A out of people, which for a reason we're about to get to would be extremely hard. But then like a domestic duck gets it, and then a person gets it from the duck, and then it's back, baby, and we're exactly where we started. But as I just indicated, influenza has another problem. It changes antigens a lot. So what's an antigen, Hank? Well, the immune system identifies pathogens by molecules that are on the surface of the pathogen, of the virus or the bacteria or the worm or the fungus, whatever it is. The immune system notices those weird molecules and it trains itself to be aware of them and attack them. And we call those molecules, the ones that the immune system responds to, antigens. Smallpox's antigens are very stable, which is why you only ever got it once. Like once you got smallpox, you either died or you'd become immune. And that makes it so a vaccine can provide really long-lasting immunity. Flu is not like this. Its antigens can swap and evolve and change, and they do that all of the time, which is why we only ever needed one smallpox vaccine, but we need a different flu vaccine every year. So first we had reservoirs, and now we have antigenic stability, two extremely important things when it comes to the eradicability of a disease. Which brings us to measles, a disease that we have eliminated from a number of countries and continents. And it is pretty eradicable because just like smallpox, it is antigenically stable and it has no animal reservoirs. And in the year 2000, we were able to declare measles eliminated from the United States, which indicates that it is possible to eliminate it from the whole world. But it's hard, and it's harder than smallpox for, I think, two important reasons. One is the disease's fault itself. It's the way the disease acts. And the other is how we react to disease. But first, the disease. On average, every smallpox infection resulted in somewhere between 3 and 6 new infections. And if you can get that number below 1, then every person infects, on average, fewer than one other person. In that situation, the disease dies. It can no longer transmit through the population, and since it's not in any ducts anywhere, the disease is eliminated. So with smallpox, you had to go from one infected person infecting 3 to 6 other people to one infected person infecting less than 1 on average. And it turns out we could do that. Now, there were also some really useful things that I'll get to that are also separate from measles. But the most important thing here is that with measles, on average, one person with measles infects between 12 and 16 other people with measles. That is a tremendously high infection rate. With smallpox, getting down below 1 might require vaccinating like 80% of people who might be exposed to the disease, while getting the infection rate of measles below 1 requires something like a 95% vaccination rate. And getting to 80% is just way easier than getting to 95%. For a bunch of different reasons. One of them being because one dose of a measles vaccine only gets you to 93% immunity. You have to get the 2 in order to get the population to 97%. So you got to get 2 shots into people separated by a stretch of time. And also for measles to maintain natural transmission, all you need is 5% of people being very hard to access or denying the vaccine, which means that only places with very strong public health systems and very high vaccination adoption can eradicate it. If you can't get to 95%, you basically cannot eliminate it. And that's just an effect of the disease. It's harder to eliminate because of how infectious it is. But another trick that measles has is more our fault, which is that it just isn't as bad as smallpox. Measles is awful. It kills people. It kills children. We should eradicate it. But smallpox is worse. It has a death rate as high as 30%, and survivors often carry lifelong scars on their faces. That's visible in a lot of different ways. It's visible in the way where you see your friends' children die of the disease. It's visible in the way where you see people walking around who have survived the disease. So the personal incentive for getting a smallpox vaccine or making sure your kids do is just extremely high. Even in places with bad healthcare systems, measles death rates were like 10 times lower than smallpox. So with measles, lower incentive, higher threshold for success. Measles has thus far escaped eradication. By my reckoning, these are the biggest advantages we had against smallpox. No reservoirs, stable antigens, relatively low infection rate, and an extremely high incentive to avoid the disease. But that's actually not it. Smallpox vaccination also can help people even after they are exposed. So if you find a person who has smallpox, you can get vaccines to everybody around them, and they will have a higher chance of having a milder disease or having no disease. And that means if you can get to those people, you can decrease the amount of transmission from that second wave. Also, people sick with smallpox are most contagious when they are most sick. COVID showed us how important that is, with people spreading the disease for many days before they even knew they were sick. Measles is also like that. It can spread before the disease becomes visible. And that visibility is also important. Smallpox has such specific symptoms. Some diseases you can have and be completely asymptomatic and not even know you're sick. Some diseases can have really terrible effect on one person, while another person with the same pathogen in their body might just feel like they have a cold. Smallpox, of course, had more and less mild cases, but it had really specific, this is definitely smallpox symptoms. And lastly, very importantly, scientists at the time figured out how to keep the smallpox vaccine active without keeping it cold. And that wasn't possible for a lot of different vaccines. Because that was possible, it made it much easier to deliver that vaccine all over the world. Not easy. It was very hard. And we should take the W. I am proud of us. But even now, lots of vaccines need to be kept cold. Now, very importantly, just because we cannot eradicate a disease does not mean that we cannot treat that disease. Many diseases that we are not going to eradicate are treatable, and we are not treating them even though those treatments exist. And we can do that work. We can make it so that vastly fewer people and vastly fewer children are dying of infectious disease. We do not need to eradicate these diseases from the world, which is good because in many cases we definitely cannot. And the only way that work gets done is if we care about it. And so to everyone who has helped support Partners in Health or Save the Children over the years to do that work, thank you so much. So much good has been done because of that, and we are prioritizing something that is extremely important that is nonetheless difficult to prioritize. There's nothing ideal about the disease smallpox. It is certainly on the top 5 list of worst human diseases, but it turns out that there were many qualities of that disease that did make it a good candidate for eradication, and so now we get to live in this better world. Though unfortunately still a world that contains diseases that are basically impossible to eradicate, but also contains diseases that are eradicable, but are very difficult to eradicate, like measles, and also contains diseases that we are so close to eradicating. I think, pretty confident that we will eventually eliminate polio. Like, we're gonna get that work done. And I am also confident that we will not eliminate influenza. I think. Who knows, John? Who knows what we will get up to in the future? But in my lifetime, we're still gonna be getting the flu. John, I'll see you on Tuesday.